And I like to show this slide a lot. This talks about the number one, the top 10 causes of death. This data was collected in 2007, and I recently did a search, and the most recent data that's been analyzed in 2007. This is in 2005, excuse me. The most recent data is 2007. And in 2007 lines up the same. The numbers are slightly different, but it's the same order. Showing disease of the heart, number one, cancer, number two, stroke, number three. You can actually take stroke and stack it on here because most causes of stroke are heart disease related. Conditions called atrial fibrillation, blood clots of the heart causes stroke. So a lot of causes of stroke are related to heart disease. So you probably take a lot of this and put it here. Then you go down to this. The striking thing about this graph is that you got these two large bars here that dominate everything else. In fact, if you take cancer out, you take the rest of these, from cardiovascular disease off, they don't collectively add up to heart disease by itself. So, when you think about it, heart disease, cancer, stroke, these are really diseases of lifestyle. You can make an argument for the rest of these, but you can easily make an argument for this. It's been well documented. So, we make an aggressive impact on lifestyle, we can make a huge impact on the cause of death. And if you look at the cause of morbidity, in other words, a lot of people are dying of heart disease, a lot of people are dying of cancer. You know that a lot of people are living with heart disease, and a lot of people are living with cancer. And so it's the people that are living with it that are also important. It's also problematic because these are people who are suffering. These are our loved ones who we're having to take to the hospital on a regular basis, doctors on a regular basis, or who are having to get medication. There's a burden of cost. There's a burden of being sick and ill. There's a loss of productivity. You know, people with heart disease are not effective on their job. They have to retire early, etc. So there's a huge impact made by just these top three illnesses. And these are well documented illnesses of lifestyle. So we can make a big impact on our life, health condition in the United States by making an impact on lifestyle changes. Our approach to this, historically and currently, is just more pills, procedures, and more, in my opinion, more sickness, pain, and money. It gets to the point that when we prescribe more medication, it isn't unusual for someone to come in the office to go on 10 medications. That's common. 15, 20 medications, I see that regularly too. So frequent medications become, part of the norm. In fact, the data's been done. I think I have a slide on that, but the majority of people with insurance are on medication. Procedures commonplace. Angioplasty is currently being done. In the mid-90s, it estimated about 800,000 a year. I think it's closer to $1 million a year now. Since then, they've had data close to $1 million a year. This procedure by itself contributed about a 10% increase in Medicare expenditure in the mid-90s. Just one procedure, hundreds of thousands of procedures and surgeries are done. The thing is that most of these procedures angioplasties are elective. Somebody comes in and have abdominal chest, have chest pain, they're not having a heart attack, they're not having unstable angina, they get an angiogram, you see that they have little narrowings, somebody goes and does a stent, put a wire across it, put a balloon, put a stent, and say, okay, we did an angioplasty. What we know is that in that setting, it doesn't work. We know that if you do 100 patients with angioplasty electively, not emergent, but electively, you get another 100 patients with the same symptoms in the same condition, you treat them with medication or no angioplasty, they end up the same. They end up with the same amount of chest pain, the same amount of heart attacks, etc. In other words, the angioplasty doesn't increase survival, it doesn't decrease frequency of chest pain, it doesn't decrease frequency of medication use. So I'll ask them, why are we doing it? I don't know. I was in a cath lab this morning, had a patient, had chest pain, the pressure was high. Did an angiogram, she had stenosis in a different vessel. And the cath lab tech said, oh, Dr. So-and-so's next door, why don't you put a stent in there? So no, we're going to treat it medically, treat it with diet, and those types of things. Because that's the treatment. You can put a stent in one lesion, but if you see one lesion, you got lesions everywhere. And so that means you treat global. Yes, sir.
I thought the angioplasty was the opening of the artery.
That's right.
Is you're saying that particular artery, you can leave it as is, where the blood does not flow through it, and it's be the same and it's getting flowing?
Here's the thing. In most elective procedures, the artery is not completely shut off. It's narrow, but not completely shut off. In an emergent procedure, like if somebody's having a heart attack, that's when you have a blood clot that's occluding the artery. In that case, it's beneficial. But if you look at these 800,000, about 95% of them are done elective. And probably about 5% of it done when it's emergently rushed in, you have a heart. If you have a heart attack, when you have a heart attack right now, you call 911, they rush you in, the best thing you have is an angioplasty instead. Emergent. Or if you're threatened to have a heart attack instead. The data has shown that's benefit in that setting. At least within 30 days, 60 days.
Right, because
If you just have those pains,
you can be treated without.
in fact, that's going to be the better form of therapy. In fact, if you look at nutrition, that's better than angioplasty and medication and bypass surgery. That's been shown.
So can nutrition clear the arteries?
It allows the body to clear the arteries. That's correct. And I'll show, that's the pictures she was talking about earlier. I'll show you where the nutrition is actually shown to open up the arteries. I'll show you some pictures that has that. Because that's essentially the treatment of choice. Because the body actually heals itself. And it gets to a very basic concept. We all know this inherently. We've all had a cut or some kind of a bruise or a heel or some kind of problem, superficial abrasion or something, and the body heals itself. We cut ourselves, the body will form a scar, but it heals itself. Our body is designed to heal itself inherently. It does it at a simple level with a cut. It can do it with a complex level with a narrowing of the artery, cholesterol buildup, and the like. It can do it at a complex level as a patient with chronic lung disease, chronic pulmonary fibrosis. And her lungs are killing itself. She was oxygen dependent. She's walking without oxygen now.
So are you saying that partially clogged artery is reversible with diet?
That's right. Yes. It's been shown. In fact, not only am I saying it is reversible, I'm saying that is the treatment of choice. It's not only am I saying that nutrition works, I'm saying that optimal nutrition, plant-based nutrition, is by far the best treatment. Now, I'm not just telling you this just based on me studying it. I've trained in the Texas Medical Center, St. Luke's, or the Methodist, Herman. I've seen the best of the best. I've rounded on the Bacon's patients, Wilson's patients. I've got defibrillators. I've practiced medicine at that level. I've seen it. I see it every day. I know it inside and out. I've done it for over a decade. So I know the standard medicine, high-tech medicine. I also know plant-based nutrition. I know both, and I compare them both side by side.